Millions of people seek therapy each year. But with dozens of approaches available, from psychoanalysis to medication to mindfulness, how do we know which treatments actually work and for which conditions? Freud's original psychoanalysis used free association, saying whatever comes to mind without censoring, and dream analysis to uncover unconscious conflicts. By making hidden material conscious, patients could gain insight into the root causes of their distress and begin resolving long-standing emotional conflicts. Transference occurs when patients unconsciously redirect emotions from past relationships onto the therapist. A patient might feel sudden anger or affection toward the therapist that actually belongs to a parent or partner. Freud viewed transference as a therapeutic window into unresolved relational conflicts. Modern psychodynamic therapy is shorter, more focused, and more collaborative than classical psychoanalysis. It still explores unconscious patterns and early experiences, but meets clients where they are. Meta-analyses support its effectiveness for depression, anxiety, and personality disorders. Carl Rogers developed client-centered therapy. The therapist provides three core conditions: unconditional positive regard, empathy, and genuineness. Without advice or interpretation, clients move naturally towards self-understanding and growth. The therapist's role is not to fix. It is to provide conditions where healing occurs naturally. Behavior therapy applies conditioning principles to change maladaptive behaviors directly. Systematic desensitization treats phobias by pairing gradual exposure to the feared stimulus with deep relaxation. Repeated pairings replace the anxiety response with calm. The behavior changes first, feelings follow. Cognitive behavioral therapy combines cognitive restructuring with behavioral techniques. It targets the cognitive distortions, all-or-nothing thinking, catastrophizing, mind reading, that maintain disorders. CBT is the most extensively researched psychotherapy, with strong support for depression, anxiety, and OCD. Dialectical behavior therapy, developed by Linehan for borderline personality disorder, combines CBT with mindfulness and acceptance strategies. Clients learn distress tolerance, emotional regulation, and interpersonal effectiveness. DBT teaches that you can accept yourself fully while committing to meaningful change. Selective serotonin reuptake inhibitors, or SSRIs, are the most widely prescribed psychiatric medications. They block the reuptake of serotonin, increasing its availability at synapses. SSRIs are effective for depression, anxiety disorders, OCD, and PTSD, with fewer side effects than older antidepressants. Antipsychotic medications reduce dopamine activity and are used to treat schizophrenia and bipolar disorder. First-generation antipsychotics caused severe movement side effects. Second-generation atypical antipsychotics have broader neurotransmitter targets and reduced motor side effects, though metabolic risks remain. Electroconvulsive therapy delivers brief electrical pulses to the brain under general anesthesia, producing a controlled seizure. It is highly effective for severe, treatment-resistant depression, often acting faster than any medication. Memory disruption around the treatment period is the most common side effect. Meta-analyses comparing different psychotherapies find that most approaches produce similar outcomes, a finding called the dodo bird verdict. Therapeutic alliance, the quality of the relationship between therapist and client, consistently predicts success across all therapy types, regardless of technique. Empirically supported treatments are therapies validated through randomized controlled trials. CBT, exposure therapy, and interpersonal therapy have the strongest EST designation. Evidence-based practice requires matching the treatment to the best available research for the specific condition being treated. Access to mental health treatment remains limited by stigma, cost, and geographic barriers. Telehealth and community mental health centers expand reach significantly. Preventive approaches, teaching coping skills before crisis, aim to reduce disorder incidence rather than waiting for intervention to become necessary.